Hi, everyone. We're just gonna wait a couple more minutes for people to log on. Okay, everyone. Hello. Welcome. Thank you for joining today's webinar. My name is Gerard Arnhem. I'm the Grassroots Advocacy Manager with the CRISPR and Dana Reeve Foundation. This is our February 2023 Regional Champions webinar. We're going to give you some updates on just the new Congress, coalition updates, grassroots. We do have today's agenda. Hold on, it's not going. All right, there we go. Here's our today's agenda. Again, congressional updates, important updates, coalitions, and some movement on our grassroots. Today's panel is going to be one of our Waxman Strategies associates, John Sawyer, Angel Hines, and then me, Gerard Arnhem. But just with time, I'm gonna kind of throw it over to John right now for some congressional updates. John?
Great, thanks so much, Gerard. Really excited to be with everybody today. We were going back at our notes, and the last of these webinars was just after the election and before Thanksgiving. So happy New Year to everyone. There's a lot going on and a lot that we expect to be going on here in Washington over the coming weeks, and we're excited to dive into this year with all of you. I'm here on behalf of Waxman Strategies, a consultant to the Reeve Foundation working on public policy. My colleague Celicia Lomax is under the weather today, but I see her in the audience, so we hope she won't ask us too many hard questions. And next webinar, she'll be back on the panel. You can go ahead and move forward, Gerard. The first thing we wanted to talk about, whenever there is a new Congress, which is not every year, but every 2 years, following an election, either a midterm election or a presidential year election, really the first few months of that Congress are spent, to be honest, the Congress organizing itself. And so one of the first things we'll go through in this slide and the next few slides is who are the new and returning members of Congress who will be in real important decision-making priority areas, decision-making roles on priority areas that we all focus on. Increasingly over the recent decades, power in Congress has really become increasingly centralized in the leadership of House and Senate, but also an enormous amount of work happens through and under the leadership of committee chairs. And so we'll talk first about the leadership, then talk about who will be in charge of some of the key committees, and then we'll talk about what are some of the issues that we'll be following this year. And what do we expect to happen? So first things first, there are a lot of new faces in leadership or in new seats in leadership. One of the big takeaways, of course, from the midterm elections of last year is that there was a change in party control of the House of Representatives. And so the House will now be led by the Republican Party, and in particular by the new Speaker of the House, Kevin McCarthy, who's been a longtime representative from California. You can see here, Majority Leader will be Steve Scalise of Louisiana. Majority Whip, a contested position, was won out by Representative Tom Emmer of Minnesota. There are also some new faces in the Democratic leadership. Longtime Democratic leader and former House Speaker, Nancy Pelosi, and her leadership team handed over the reins of the Democratic leadership in the House, which will now be led by Representative Hakeem Jeffries of New York. And his number two will be Minority Whip Katherine Clark of Massachusetts. And so, one of the big things I think that we will see in the coming year, and we'll talk about the Senate in a second, is the new leadership sort of finding its way. We had some of the same members of Congress in these positions for several Congresses in a row. Speaker Pelosi was one of the longest serving leaders of the Democratic caucus in the House. And so each of these new faces or familiar faces in new roles will be finding their way going forward. Switching over to the Senate, Gerard, you can advance the slide. It is actually more familiar faces. The Senate control did not change. And in fact, it went from a 50-50 Senate with Vice President Harris breaking tie votes in the Senate to a Senate that the Democrats now have a very slim 51-49 majority. Democrats in the Senate will be led once again by Senator Schumer of New York, as well as Senator Durbin, and Senator Mitch McConnell of Kentucky. Now, I think the longest serving Republican leader in the Senate will continue in that role, assisted by Senate Minority Whip Senator John Thune of South Dakota. So moving on from the leadership, who makes so many of the decisions about what issues get prioritized, what things get voted on the floor, how sort of big picture strategy is determined. Within particular issue areas, much of that decision-making happens within congressional committees. That's where our team really spends a lot of time engaging, is with the staff and the members on specific committees. And so we won't go through all of these, but these are some of the key committees that really shape some of the policy areas we follow closely. First and foremost, the Appropriations Committee, and within that committee, the subcommittee that includes funding for the Department of Health and Human Services, are really crucial committees in both House and Senate. Those are the committees, and we'll talk about this in a moment, that manage the annual process of setting the funding levels for thousands and thousands of federal programs, including several programs the Reeve Foundation prioritizes that many of you all are familiar with. So with the change in majority status, the Republican members will now be the chairs of those committees, and the ranking member is the name for the lead member of the minority party, in this case, the Democrats. And so Kay Granger, longtime Republican member of the House from Texas, will lead the Appropriations Committee, and Robert Aderholt, member of Congress from Alabama, will lead that subcommittee with focus out on HHS. Congresswoman Rosa DeLauro of Connecticut will be the lead Democrat on both the full committee and that subcommittee, and will continue in that role that she served in the last Congress, albeit in the majority. Won't go through all these, but some of the other committees we follow, the Oversight Committee, the Transportation and Infrastructure Committee will talk about some of the key issue areas we'll be following in transportation this year. The Ways and Means Committee also has jurisdiction over both tax issues and Medicare. So just some of the key decision makers in the House, and then we can move on to the Senate. In the Senate, similarly, there are some changes at the top of the Appropriations Committee. Senator Murray of Washington State will now be the lead Democrat and chair of the Senate Appropriations Committee, with Senator Susan Collins serving in that ranking member position. Of note, and I think this is exciting and overdue, but really I think will have a real impact, between Congresswoman DeLauro, Congresswoman Granger, Senator Murray, and Senator Collins. This will be the first time in the history of the nation that the leads, so-called four corners, the lead House, Senate, Republican, Democrat on the Appropriations Committees, will all be women members of Congress. Each of them longtime serious legislators, I think, who approach these issues in a bipartisan way, in a collaborative way. So that will be exciting to see. The Labor HHS Subcommittee in the Senate will be chaired by Senator Tammy Baldwin, who, as folks who've been on these webinars before know, has historically been a real champion of the Paralysis Resource Center in particular, and just announced, actually, the ranking member on that subcommittee will be Senator Shelley Moore Capito of West Virginia. You can see some other new names, I think, in key committees across the Senate. The Senate Finance Committee will remain the same. That committee has jurisdiction over Medicare, Medicaid, and tax issues. The Senate Health, Education, Labor, and Pensions Committee will have new leadership in the form of Senator Bernie Sanders. That committee was previously chaired by Senator Murray, who's gone on to now chair appropriations. Senator Sanders will be joined in leading that committee by Senator Bill Cassidy of Louisiana. And then the Judiciary Committee, anytime there are court nominations or judiciary issues, comes into the spotlight, so we'll be keeping an eye there as well. So let's move on to sort of the process of the entire year. We can go to the next slide. And really the important milestones in a new Congress getting started with its business, it often begins ceremonially with the President's State of the Union address, which was a few weeks ago now, but I think which really set the tone for the coming year. Obviously, things will be different in this Congress with divided control of the Congress and a different party in control of the House than the White House and the Senate. But you can see here some of the key points that President Biden hit on in his State of the Union. A heavy economic message. One of the things that I want to focus on for just a moment is the third bullet here around the debt ceiling and entitlement reform. We will come back to this in future webinars because we expect it to be a big issue over the course of the year. But just to say, we don't have to get too deep in the weeds of it, but one of the things Congress has to do this year that's considered must pass is they need to raise the statutory debt ceiling for the United States, essentially raise the amount of money that the country can borrow in order to pay its obligations. That is something that has happened regularly over the last many decades. It's something that has always happened. If the Congress doesn't do it, the US is at risk of defaulting on its debt. But it is always a contentious issue, especially when there's divided control, because it's a point of leverage. Anytime there's a must-pass piece of legislation, varying parties want to come together and see if they can, negotiate certain policy changes to accompany that change. So one of the big things that was talked about in the State of the Union, if you watch the State of the Union, there was some back and forth between the president and members in the chamber about this, was whether or not entitlement programs like Social Security and Medicare will potentially be on the table in those negotiations. It seems coming out of the State of the Union like those two programs in particular will not be on the table, but that's something we're going to be watching closely because within the overall federal budget, it's tough to make a real dent in federal spending without really taking a serious look at some of the larger programs like Social Security, Medicare, Medicaid, defense spending, interest on the national debt. Those make up a huge proportion of the budget. The part that's subject to appropriations, which we'll talk about, actually makes up only a fraction of the budget. So as folks are having a conversation over the coming year about lowering spending, lowering the deficit and the debt, we'll keep a close eye on what the implications that has for those larger programs that are important to so many. The president also touched heavily on healthcare. He renewed his call for major investments in our system of caregiving, specifically through investments in Medicaid's home and community-based services program. This, I think, throughout the Biden administration, caregiving and the care economy have been a pillar of the president's focus and agenda, and so we expect, that to continue this year as Congress figures out what it can and can't do. The president also talked significantly about affordability of healthcare and touted some of the law that passed at the end of last year, giving Congress or giving the administration for the first time the authority to negotiate prescription drug prices through Medicare. That legislation also included a $35 monthly cap on out-of-pocket costs for insulin. That was specifically for people covered by Medicare. The president called for extending that cap to everyone with any different kind of insurance coverage. That's something that could come up in the agenda this year. The president also spoke to, I think, something many of us are feeling in different ways and in different iterations in our own lives, but spoke to sort of the passing in some ways of the COVID-19 pandemic. Obviously still a public health concern, but the federal designation of a public health emergency, which is a term of art in federal law, is coming to an end. That public health emergency will come to an end in May, and that carries with it implications for a number of different issues, from how vaccines will be covered, who will be covered by Medicaid in particular. During the public health emergency, Medicaid has been prohibited from redetermining coverage and basically determining that people are no longer able to have Medicaid coverage. That's something that's going to change now. So people are really going to be going through a process of redetermination of their coverage. So a lot of things are tied to that public health emergency declaration, and the fact that it's coming to an end not only signals a different phase of the pandemic, but some real policy changes that we'll be following. A number of other issues listed here that the president focused on, and the speech overall, I think, covered a broad range of issues and really set the tone of, there are certain things that the Congress and the administration can do in a bipartisan way in the year ahead, even with divided control. And then there are certain things that the administration is going to continue to focus on, whether or not the Congress is able to weigh in and make changes. We can keep going. So one of the things we just mentioned was the appropriations process, which of course is the annual process whereby program levels for thousands and thousands of federal programs are set by Congress. Congress has that exclusive power. They call it the power of the purse, where they set the funding levels and which are also called appropriations for specific programs. So looking back, was a successful year in terms of some of the priority areas that the Reeve Foundation and Reeve advocates worked on in appropriations. We saw an increase in funding up to a level of $10.7 million for the Paralysis Resource Center. This was the third such increase over the last number of years, and has really allowed Kim and Gerard and Angel's colleagues who work in the Paralysis Resource Center to expand their work and to really reach more additional people and do more innovative programming. The appropriations process also includes funding for a number of other priority areas mentioned here, and Kim will speak later to the foundation's priorities for the year ahead. And while that process ended just at the end of last year, we are already well underway into the process for the coming year. And so one of the things you as advocates will be hearing from our team about within the next month or two is, once the appropriations process is underway, that begins with the president's budget request and the administration's sort of formal roadmap or blueprint for what they would like to see from Congress in terms of funding. That comes on March 9th. And then following that, the Congress really gets down to work in earnest on figuring out its appropriations process. So what we don't know is how that process will end this year. It is one of those must-pass things that has to go through a process, but with a need for bipartisan agreement this year, it could be difficult to get to final resolution on appropriations, especially within some of the timelines that the Congress faces. So we'll be keeping a close eye on that. And then we can go to the next slide. And this is really just a little bit more about the timeline for that, really the remainder of the federal fiscal year, which ends at the end of September. As we said, the President's State of the Union kind of kicks things off. We'll see the president's budget released early in March. And then really through the spring and into the summer, Congress will hold hearings. They'll develop the appropriations legislation in committee. They'll hold what are called markups, where they go through that process in committee, offer amendments, change funding levels, potentially, hopefully, if the process goes well, pass those bills out of committee, and in an ideal world would pass those bills through the Senate, through the House, before September 30th, which is the end of the fiscal year. The ideal world has not been the case in recent memory. And so typically what will happen at the end of September is we'll see Congress kick the can down the road for a few months through what's called a continuing resolution. But we can always hope and dream that they will get their work done on time. And in the meantime, we will be engaging with Congress as though that's going to happen. And so we'll keep this group updated in future webinars as that process plays out, and action alerts and other things. But that's a little bit of a snapshot of the year ahead. So I think with that, I am going to turn it over back to Kim to take it from here and talk about some other crucial updates.
Thank you so much, John. And I want to thank all my colleagues who are panelists today. And I want to welcome everybody. I know we can't see you directly, but I want to thank everybody for consistently joining our webinars. It's I know we're almost at the end of February, but I hope everyone had a good new year and that everyone's staying safe and healthy. And I will get to some updates in a moment, but I really just want to say on behalf of the Reed Foundation, thank you so much for all the work that you've done in any capacity with the foundation, especially on our advocacy front. Because as John mentioned, we have really achieved some major wins last year, and it couldn't have been done without all of the work that our advocates. We can't do this work alone. So I just wanted to start out by saying that. The next slide, please. Before I start, I wanted to acknowledge one of my favorite people, a person that I came to know when I first came to the Reed Foundation, Joseph Preddy, who is from the state of Washington. And he was a passionate and a really productive and tenacious regional champion for the last 5 years, working very closely with me and our team. He also was a peer mentor for the foundation and really saw the foundation as an organization that really helped him in a really dark time when he was injured. We learned from his family that he passed away in early December of 2022. And I was shocked and so saddened to hear that. Joe never let us down. He consistently met with his members and his senators and really was responsible for helping us really achieve some of the major funding increases. And he never not answered a call to action, and he will be missed. He was my friend, and I am so grateful for all that he contributed to the foundation, but also the paralysis community, and my condolences to all his friends and family. And that is a picture that he sent me proudly after his first congressional meeting with his representative at the time, Representative Davini, with whom we now have a very close relationship with. And I wanted to just make sure that we spend some time honoring Joe and his memory and his legacy, and we will miss him very much. Next slide, please. I started out by talking about Joe and all the contributions that he made to the advocacy team and to our program. And I just want to reiterate, we want to spend a lot of time this year encouraging more people to join our efforts, but also to become part of our community. And we really want to make sure that we're able to connect with all of you, maybe in a more informal way. And we hope to see people in person. And we really encourage you to reach out to Gerard, get to know him. I know it can feel very sterile just being on a webinar, not being able to see each other, but it is really important that you're part of our community. We're very, very grateful for that. So for anyone who's new, Gerard will make sure that he'll share his personal information, his email with you. Please reach out to him. And, as I mentioned, Joe really contributed to a lot of our successes, as many of you have too. And I don't want that to go unnoted before we start talking about the new year, which we're already almost into March. But as John mentioned, we had a huge increase for the Paralysis Resource Center. For those who may not know, we have operated the Resource Center since 2002. We have been able to assist over 120,000 individuals over the life of the Resource Center. We're really proud of the work that we do. And every time Congress acknowledges the work that we do and invests more dollars, we're even prouder. And we really owe that to all of our really strong and coordinated and consistent advocacy efforts. So I wanted to note, and John briefly touched on this, the last year, Congress passed 2 appropriations bills in 1 year, which is kind of unique. It's not really supposed to happen that way, but as we've learned in the past few years, Congress sometimes operates on its own calendar. So over the course of those two appropriations bill, we saw a $2 million increase with at least 1.3 million going directly to the resource center. So we are currently now a $10 million program. This is a huge success. I want to thank everybody who contributed to that, and we are grateful that we can expand our services and our reach to more people around the country. Other increases that we saw around National Institutes of Health, and of course NIDLR, with whom we worked closely with United Spinal around this advocacy issue. And we also hope this year to spend more time educating our advocates on these particular issues, because we, transparently have not done a great job educating all of you on why these research entities are important for the paralysis community. So we're committed to ensuring that we do more education on that, but we did see some increases over the two appropriations bills that passed. And then finally, and if my colleague Angel has anything to add to this, please jump in, but we saw that the Able Age Adjustment Act was included also in the final year-end omnibus bill. And it was a major win. We've been working on this for several years now, I think, to extend the age, raising the age of onset from a disability. Currently, an individual who is applying for an ABLE account, their age limit was 26. And so we've been able to raise that to 46, which is a pretty big win. It's not exactly, I think, in the end, what we had hoped for, but it is still a really great achievement, because now more people can take advantage of these accounts. And again, my colleague later will talk a little bit about a recent webinar she did around some of these particular issues and learning more about these accounts. And also during COVID, or at the beginning of the onset of COVID, Medicare changed its rules around telehealth coverage. And so many people were able to take advantage and access their healthcare providers via telehealth services. And Congress has extended that through 2024. We also have posted a blog that lists all of our accomplishments last year, but I just wanted to highlight a few. And again, thank you for all that you've done. And we have a lot of work this year to do. We'll go into some of those issues. And next slide, please. This is just an illustration over the history, just for your information, and we're happy to share. We'll share the slides, but we can also share this background information with you if you're interested, especially if you're coordinating meetings with your members of Congress. The Resource Center has seen considerable increases over the last several years, and I just wanted to highlight that in a graph form, because it is a wonderful achievement that all the advocates in our foundation was able to achieve because Congress really believes very strongly in the Resource Center. They understand it's the only federally funded paralysis organization that helps individuals managing spinal cord injury and other conditions that cause paralysis. So, and as John mentioned, we're starting FY24, so we'll update that as soon as the president's budget comes out, and we'll start our whole process again. And next slide, please. I want to pass this over to my colleague Angel. She'll talk a little bit about a needs assessment we conducted at the end of last year, and then I'll be back. Thanks, Angel.
Get off mute. Thank you so much, Kim and John, Gerard, for all of these updates today. But I'm really excited to give a quick update on our needs assessment survey that we did last fall. Thank you so much to everyone on the call or who's watching later who participated in the survey. We really appreciate all of your responses. This was the largest response to date with this biannual survey that we do every congressional cycle in conjunction with Vanderbilt University. We had almost 600 respondents, pretty much half and half, people with disabilities and caregivers, friends, supporters of Reeve. We were very pleased with the responses, and you guys everyone really let us know what are, really helped to inform our priorities for the year. The top 7 most important issues for research for treatments and cures, home and community-based care services. Caregiving is so important to everyone. Public accessibility, inclusion, and universal design, health insurance, access and coverage of services, prevention of secondary conditions, assistive technology, and affordable and accessible housing. So all of these issues are things that we are working on here at Reeve, and not just in our advocacy work, but in all different programs across the foundation. So thank you again for that. And Kim, if you want to share now how these have informed our priorities for the upcoming year.
Sure. So the needs assessment is really important. And as Angel mentioned, we do this every congressional cycle, and it's really important to hear from our entire community. And we take this information, not only share it internally with all of our colleagues to ensure that the work that they're doing reflects the needs and the wants of the community, but also that our advocacy priorities reflect that. We try really hard to match those up, especially because we want to make sure that we can be successful, we can provide, actually have impact on some of these issues, and that we are, some of them are actually unique to this community and to the foundation. So a lot of the issues for this year are not entirely different from previous years, but I want to highlight a couple of things here. And as you know, of course, the Resource Center will always be one of our top priorities. It's really important that we ensure that we educate Congress on its impact and that we are good stewards of federal dollars and are educating the impact across the country in everyone's congressional district. So we will be advocating for level funding this year at $10.7 million for FY 2024. And we will ensure that any advocate who would like to coordinate a meeting with their member, that you have all this background information, because not only is your personal story really important, but it's also important to share what the Resource Center is doing for constituents in that area of the country. As I mentioned earlier, we worked with United Spinal on advocating for increased funding for the SCI and model systems. They are funded within the Institute NIDLR, which again, Washington loves an acronym, the National Institute on Disability, Independent Living and Rehabilitation. And as I also mentioned earlier, we're going to do more on educating everyone on what this is. Hopefully we can invite the director of this program, and so you have and also educate what's happening at NIH and the Department of Defense. We heard loud and clear that research is a top priority. So we will include this in our education going forward for the rest of the year. And third, caregiving is something that we all know is a crisis. We all know everyone has unique situations that they're managing and dealing with, and it varies by family, it varies by state, it varies in so many different ways. And we really feel committed to continuing to work with policymakers on not only sharing, ensuring that our advocates share their personal stories about the difficulties and the crisis around this issue, but that we work to identify, tangible ways that we can make a difference on the legislative front. So this is a really important issue for the foundation. And then finally, as you know, we've been working tirelessly over the last few years around air travel, and we're hoping that this year we'll be able to get some really key provisions included in the FAA reauthorization, which comes up every, I think, 5 years, and it's set for reauthorization this year. So we will be monitoring that. And again, personal stories are really, really important, and using social media to really highlight the difficulties around traveling in any capacity, but especially air travel has been really effective to get the story out there and to really impact members of Congress who may not know anybody who's living with a disability or has any idea how difficult it is. Next slide, please. Oh, great. So those are our priorities. We will spend a lot more time this year educating our advocates on each of those. And I want to now pass it back to my colleague Angel, who spends a lot of time in our coalitions. Angel.
Thank you, Kim. So next slide, please. So I thought it would be good, since it's our first update of the year, to just remind everyone what coalitions that we serve on. I'm the liaison to these coalitions for Reeve, so these are the meetings that I attend. We are a member of the CPR Coalition, and we are steering committee member with the CPR Coalition to preserve rehab. The ITEM Coalition, which is Independence Through Enhancement of Medicare and Medicaid Coalition. We are a steering committee member with the ITEM Coalition. DRCCC, Disability and Research Rehabilitation Coalition. The Habilitation Benefits Coalition. And the Air Carrier Access Act Working Group. We're a very active member here due to the 2023 FAA reauthorization that Kim just mentioned. And then one of the largest coalitions that we participate in is CCD, the Consortium for Citizens with Disabilities. I am a member of the task force, the Health Task Force, Long-Term Services and Support, Social Security, and Transportation. And the latest task force that I've joined is the Housing Task Force, because that ranked very highly in our needs assessment survey, and we really want to listen to what our advocates need. And so I'm thrilled to now sit on the Housing Task Force. Next slide, please. And just a few updates. This past January, I attended the ITEM, CPR, and CCD coalition annual meetings, as well as my colleague Gerard joined me at a few of those meetings. It was, they were held virtually and in person, so it was really nice to be able to meet with other disability rights organizations in person to talk about all of our priorities for the upcoming year. So that was held last month. And then as Kim mentioned, with our priorities, all of us were working towards the 2023 FAA reauthorization, and the Air Carrier Access Amendments Act has a new congressional lead, Representative Dina Titus from Nevada. She has taken over for Representative Jim Langevin, who retired last year, and she's working with Senator Tammy Baldwin. And I expect that to be introduced in the coming days, definitely, if not this week, next week. So stay tuned for more information on that. And as Kim said, if you have stories on your experiences with air travel and would like to share them, please get in touch with Gerard or myself, and I would love to hear from you to share the stories with the working group and coalition. And also the ITEM Coalition update. As you may have seen or heard in our announcement on our social media last week, Center for Medicare Services, CMS, released their proposed decision for coverage of seat elevation systems for power wheelchair users in Group 3. So thank you so much, advocates, on that. When you hear from Gerard in a minute, he will share with you more steps on that process, what we're going to be doing. But we are this is really good news, and what a lot of people have been fighting for the past few years. So thank you, advocates, for that as well. Next slide. Before I go, I just wanted to take a moment, especially since it is Black History Month, I wanted to remember and honor disability activist Lois Curtis. Lois Curtis recently passed away this past fall, and she was such a huge fighter for disability rights. Lois was one of the lead plaintiffs in the landmark Supreme Court case Olmstead versus LC in 1999. This case established the right of individuals with disabilities to live in a least restrictive setting as possible. When Lois was young, she had cognitive and developmental disabilities, and in her youth, she spent many years in and out of institutions ranging from jail to psychiatric hospitals. And so this led to the Atlanta Legal Aid Society assisting her in filing a lawsuit against the state of Georgia, claiming discrimination under the ADA for all the time spent that she was forced into these institutions. So the Supreme Court ruled in her favor in 1999, and she continued to be a lifelong advocate for the rights of people with disabilities until her death. I really love this quote from ACL Administrator Allison Barkoff, that Lois Curtis and her steadfast advocacy has profoundly shaped the disability rights movement. Our community has lost one of our heroes. So I wanted to make sure to speak her name today, disability activist Lois Curtis. Next slide. And finally, our Reeves Road to Financial Awareness series kicked off this month. We held our first event on February 8th, a Strengthened Path to Financial Literacy, with our partners Able Today and Wells Fargo. You can find the recording of this on the Reeve YouTube page. And this was a great way to start off since, as Kim mentioned, the Able Age Adjustment Act was included in the omnibus and passed. And so there's going to be millions more people that are going to have access to these Able accounts. So we are really excited to do all we can with our community partners to get more people informed about these Able accounts. And so we're really thankful for that partnership with Mark Raymond, who's also in a picture there with Gerard from a meeting that they held in DC a couple weeks ago. So not only are we talking about Able, but these financial resources programs are going to be focused on the BIPOC and underserved communities within the paralysis and spinal cord injury population. And we're going to be talking about financial health, housing affordability, accessible banking, small business growth, sustainability, and environmental justice. So these sessions are going to be really good and something that I know the community is looking for. And I also just wanted to say, because I think there was a question about issues of affordable housing. And since I think the question was about issues, if we're going to be addressing those issues with affordable housing for universal design. And so that's one of the things that I will be monitoring with the coalitions. And I definitely will send it out either in the Regional Champions newsletter or anything that I hear about. I will make sure to let the community know. So I feel like I said a lot, so I am going to pass it over to Gerard right now.
Okay, thank you so much, Angel. I'm going to go to the next slide. I'm going to give you guys a quick update on I'm being mindful of the time, but a quick update of our grassroots front at the foundation. So let's just jump right into it. Okay, so year in review for grassroots. This past year, we've had over 2,000 individuals take action on our campaigns, which means action alerts. Over 9,600 emails were sent to our legislators, and we've had a total of 915 new advocates join on our online advocacy platform. Now, as you guys may remember, in our past webinars, I'm always saying, please join, like sign up. It's very exciting when new people sign up to on our online advocacy platform. Again, it helps you show your support for the foundation, as well as becoming a little bit more involved on issues that can either affect you or someone that you know, or just anyone who is living with paralysis. But before we go to the next slide, some of the issues that mattered most last year for the people who took action on most of our action alerts was the MPRC funding for both fiscal year 2022 and 23. Now, John and in the beginning of the webinar said that yes, appropriations, we did pass 2 appropriations bills last year, one for fiscal year 2022 and the other one in December for fiscal year 2023. Another one was asking for support of the Air Care Access Amendments Act, as well as increased funding to the spinal cord injury model systems. Currently, there are 18. Kim mentioned that on our previous slides. So if we just kind of jump to our next one. I do have a big announcement. We did hit, we are now over 10,000 online advocates nationwide. Again, we could not have done this without you. So really thank you for anyone who's watching or anyone who's going to watch the recording. Really thank you so much for lending your voice and just kind of showing support for the foundation. I did put a QR code at the bottom of the screen. So if you do want to scan, if you're not an online advocate and you're watching the webinar now, you can totally scan and it will take you to our online advocacy sign up page. Or you can text advocate to 52886. Just know the standard messaging and data rates may apply. But again, yeah, we could not have reached this ambitious goal if it wasn't for our dedicated online advocates spreading the word. Again, please, if you have the link, please share it with your friends, family, networks, anything, because we can always take more online advocates. Currently, as of now, we have 10,115. So that is a lot. They're all over in all 50 states. And our goal is definitely to reach 12,000 by the end of this year. So again, please keep spreading the link out, get your friends, family to sign up. It's a very exciting time. And I'm very happy since I joined in July of 2022, that we reached our 10,000 advocates threshold. So I just, again, thank you. And for those of you who are new to the Reef Foundation or just watching, I just want to quickly remind what online advocacy is and what it does for our foundation. Basically, online advocates write emails, letters, make phone calls, and send messages through social media to their members of Congress. So it could be either their congressional member or their 2 senators. But online advocates also take action on our action alerts. By being an online advocate, you will become part of a nationwide community of individuals who wish to speak up on behalf of the paralysis community. Again, just a reminder, like online advocacy, we couldn't do any of these legislative wins that Kim mentioned without your help. And it is the central part of the foundation's mission. And again, to be an effective advocate, you must be informed. I always like to say knowledge is power. So again, you always want to be informed on the certain issues that the foundation is working on, and then just meet with your members. And it could be really easy. And I can also help you if you want to reach out to me. I think on the next slide, I do have or a couple of slides from now, I do have my contact information. So if you ever want to get involved, meet with your member of Congress, just shoot me an email and I will try to connect you and we'll get an appointment scheduled. So on the next slide, I just want to kind of go over some of our advocacy wins this year on the grassroots front. Like I said in our previous slides, we did increase our engagement of our grassroots advocacy base, a 10% increase of new online advocates in all 50 states. And we currently have 53 regional champions from 26 states. The next bullet point, it is describing what Angel mentioned before that I'll go in more in detail with, is CMS opened a national coverage analysis for coverage of power seat elevation systems in power wheelchairs. That was back in, I believe it was August of 2022. And we had over 3,500 advocates share their unique stories with CMS to express their need for this critical technology. However, our new update is that on February 15th, which was last Wednesday, CMS proposed to cover seat elevation systems in Group 3 power wheelchairs as a Medicare benefit. In regards to this announcement, they are now opening up a public comment period that is accepting comments until March 17th. But again, this is the result of years of tireless advocacy work from the ITEM Coalition. Angel said we are a steering committee member of that coalition. And just the dedication and support from advocates like you who are watching. However, we are asking everyone who is watching or will watch later on the recording to submit your own personal unique comments in support of this decision. CMS, like I said, you have until March 17th, which is St. Patrick's Day. So anyone who's celebrating St. Patrick's Day, happy St. Patrick's Day, and make sure you do your comments. But there is a website dedicated that with the help of the ITEM Coalition, they set up a website called riseforaccess.org. That's RISE, R-I-S-E, 4 access.org. And again, it's been updated to help give our advocates suggested talking points and further instructions on how to successfully submit a comment to CMS. But again, thank you all for this amazing work on this important issue. Please share this information and comment opportunity within your networks. Again, we want to get as much comments as we can. Hopefully get more than last August, last September when that comment period closes. So let's shoot for 4,000. But again, just make sure you spread the word. I will also include all this information because I know I'm talking a lot, but I will definitely include all of this information in our follow-up email. And last week, we do have a 2022 Advocacy Roundup blog post, which is on our website right now. I will include that link, but you can see all of our full advocacy wins from this past year, and it's all located on there. And again, if you have any questions, please reach out to me, but we could have done it without you. The last 2 bullet points are just the Department of Transportation in the beginning of the year, I believe they held public virtual meetings to hear from the disability community to learn and improve airline practices and policies moving forward. Over 1,000 people registered. And then finally, in July of 2022, we had the Department of Transportation release the Bill of Rights for airline passengers with disabilities. Again, this is all more information can be found on our blog, and I will make sure to pass that along to you. So moving on to our next slide. I just want to quickly talk about expanding our regional champions program. Again, strength in numbers equals more regional champions. Like I said earlier, we do have 53 regional champions in 26 states. And we have a goal of having a regional champion in all 441 congressional districts. That's including the United States territories such as American Samoa, Guam, Northern Mariana Islands, Puerto Rico, US Virgin Islands, and DC. So if anyone watching knows anyone or has a connection to anyone in those territories, I would love the opportunity to connect with them or you to try to recruit them as a regional champion, because again, strength is in numbers, and more regional champions means we can have more advocacy wins going forward. Before we move to the next slide, I just want to quickly mention, since joining the public policy and advocacy team in July of 2022, I've connected with lots of our regional champions. And again, we've had great conversations. Again, sometimes could just be just to say hello, get to know me more. But I did send out a regional champions email about 2 weeks ago about just kind of updating contact information. So if any of the regional champions that are watching have not responded, just whenever you get a chance, I just want to make sure that you have the most up-to-date contact information for you, as well as just, that I can know who your member is, and you can know as well who your members is. But anyway, sorry, I lost my spot. Finally, as we stated in the beginning of the webinar, the appropriation season is starting soon, and I would like each of our regional champions to meet with their members of Congress, tell their story, and speak about the NPRC. Again, please reach out to me for any assistance. My contact information is listed at the bottom of this slide, and you all, whoever registered for this webinar will be receiving a follow-up email from me with all the information. If you don't know who your member of Congress is, you can always go to house.gov, and on the top right corner of the website, you can just enter in your zip code and you can find out who your current member is. This is the first Congress that has with redistricting, so your member might have changed due to this. So it's always good to check in on who your current member of Congress is, because like I said, it might have changed in the past. And then going forward, I know we're kind of running a little bit low on time here, but I just want to say we realize that everyone has been Zoomed out, webinared out over the past couple of years. And I have spoken to some of our regional champions just to get feedback on our webinars. And if you have any advice, suggestions, or comments on how to make these webinars more engaging, please put them in the chat box. I mean, any ideas are welcomed and are very helpful. So thank you again. Okay, upcoming actions needed. I will be emailing out these links to these actions listed on this slide, but first is an action alert that is completed, and I just need to publish it on our online platform, is an action alert to welcome the 118th Congress. We're asking everyone who's watching, watch this recording, please take action on this action alert. Again, it's just for our regional champions and our online advocates to send their member and senators a note to welcome them to the 118th Congress, and to let them know about the 2023 Reeve Foundation priorities, which Kim went over in previous slides. The next upcoming action item is the call to action on the CMS proposed decision to cover power seat elevation systems. Again, we're going to be asking you to go to the CMS website, submit your own unique comment in favor of the decision. And as I mentioned before, there is the website risefораccess.org that can help give you some talking points and advice on how to submit a really great comment. But please be on the lookout for these links in my Regional Champions newsletter. I'll be sending one out next week, as well as an email from the Reeve Foundation. Next slide. And then finally, on this last slide, we want you to know that the Reeve Foundation will be hosting a virtual Advocacy Day coming at the beginning of May 2023. More details will be released soon with the date and time for this event, but this is a great opportunity for our advocates to meet with their congressional staff members and speak about our advocacy priorities and tell their story. When registration comes out, I encourage each of you watching to sign up, because I know it will be a very exciting day. I'm super pumped for it. So I think everyone else should be very excited because, again, you're making that connection with your member. And it's just really important, and you can participate in the governmental process. But I know we have like 3 minutes left, but does anyone have any questions? Kim, Angel, have you been watching the question box? Anything pop up?
Yes, it looks like, and thank you so much. We got right under the wire.
I know.
Thank you, Gerard. Someone asked us about the survey results. And Angel, I don't know if you want to talk about your one pager. They asked if survey results will be publicly available and where people can find those results.
We will. I'm working on a brief summary of the survey results. So stay tuned when Gerard I will make sure to get those out, and we'll be posting those, and stay tuned for that.
Thank you, Angel. And then Gerard, we had an advocate mention that they signed up. I bet they became an online advocate, and I will send you their name so you can reach out to them directly.
That's great. Yeah, no, sign them over.
Thank you.
I'm excited about that.
Thank you for signing up. And I think, let me see if there's any others. I think we answered the rest. It's been a while. Yep, I think we did.
Okay. Again, our next Regional Champions webinar will be held possibly towards the end of April. So please stay tuned for that. Again, time and date will be released soon. But again, please contact me with any questions. I'm always here. I'm happy to just talk to you just about pretty much anything. So please feel free. But if that's everything, then thank you all again so much for joining us. We've really appreciated just giving you this presentation. And yes, we are coming in right under the wire. We have 2 minutes left till 4. But please be on the lookout for all the announcements that I spoke about. And again, thank you so much. We could not have done this without you. Have a good rest of the day. Bye.
Thank you.
Thank you.